My name is Nick Cunniffe, and I'm a neurologist specialising in multiple sclerosis working in Cambridge. Today we're going to talk about lumbar punctures, which are a commonly deployed investigation as part of the diagnostic journey for someone with MS and indeed many other neurological conditions. It's a very simple test, although it sounds quite daunting. What we're going to do is going to get someone to lie in the correct position on the left-hand side over in the bed, essentially to crawl up into the fetal position so that we can expose the lower part of their back. That then allows us to then clean the skin around the lower part of the back, to then use a numbing agent, a local anaesthetic, to make the area nice and numb. And then we introduce a very small needle into the lower part of the back, and that allows us to sample the spinal fluid. This is really, really valuable because it allows us to determine whether there are markers of inflammation in the spinal fluid consistent with multiple sclerosis. Now, it has to be said that a lumbar puncture, while often abnormal in MS, is not always abnormal. So you can get normal results in lumbar punctures and still have MS. But it's still a really valuable piece of information as we try and put together different parts of the puzzle to make sure that we are dealing with MS as opposed to another diagnosis. So I'm now going to show you what a lumbar puncture looks like. But first, I should just explain a little bit about the benefits and the risks of having one of these procedures. So the benefit is that it gives us important information about the diagnosis. It allows us to rule out other conditions, but also allows us to better be sure that we're dealing with MS as opposed to something else. That's the benefit. In terms of the risks, well, actually, they are fairly few. So whenever you're doing any tests with a needle, there's a possibility of introducing infection. But we wash our hands, we do sterile procedures, so the risk of introducing infection is really negligible. There's a possibility of bleeding, and that's why the doctor beforehand will check to see you're not on any blood thinners, may even ask you to stop blood thinners before the procedure if you are on them. And also sometimes we'll check some blood tests if you have had them, but it's not essential that everyone has blood tests before this being done if you're otherwise well. The main risk of having a lumbar puncture is a headache. So about 30% of people after a lumbar puncture will experience a headache. And it's a slightly unusual headache. It's what we call a low pressure headache. So it's a headache that often will be quite bad standing up, but almost disappear lying flat. It has that striking postural relationship. And it's caused because the very small hole that's left after doing the lumbar puncture with this very narrow needle in the lower part of the back, sometimes that hole just takes a little time to seal itself. It almost always does. So there's a very, very rare chance after having a lumbar puncture, you might actually have to have a procedure where we put a little bit of blood in afterwards to seal that hole. We call that a blood pack. The chance of that is less than 1%. So by and large, it's a very, very safe procedure. And the main thing that happens is occasionally people get a headache. And you can reduce the chance of getting a headache by staying very hydrated. And sometimes people say caffeinated drinks help. So lots of Coke, teas, coffees after your lumbar puncture is often a good idea. So the first process in performing a lumbar puncture is actually to get the person in the right position. So if you're having a lumbar puncture, the ideal position is to be lying on your left-hand side on the couch, so it'll be on a hospital bed, with the legs brought right up to the chest. So this is often described as the fetal position. So usually what I would do is get someone to be cuddling a pillow, crawled into a ball on the left-hand side. And then once we've done that, we then look for certain landmarks to try and make sure that we're in the right position. So what we are aiming for is a space in the spine toward the lower part of the back, far below where the spinal cord is. The spinal cord actually finishes high up in the lumbar spine, about L1 or L2. And actually we go much lower, L3, L4, sometimes L4, L5. So we're well clear of any important structures like the spinal cord. That's why it's in the lower part of the back, because that's where it's safe. In order to work out where that is, we feel the top of the hips, and then we will find a point in the middle of that, which typically is about L3, L4. So you'll feel, oftentimes if you're having this done, a doctor or a specialist nurse feeling the structures in the lower part of the back to work out where the bones are, where the bony landmarks are, because we're going to have to go between those to try and get this sample of fluid. Usually what they'll do is they'll identify where it is and then mark it so they know where to go. After washing my hands, I'll put on some sterile gloves. And one of the first steps is to clean that area of skin. So starting in the middle where we're going to do the lumbar puncture, and then go out in a large area. Then I'm going to draw up some local anaesthetic, and this is important because it's going to be the numbing agent that's going to make that skin there nice and numb. This is something called lidocaine, which is a local anaesthetic. Oftentimes you'll be asked if you're allergic to local anaesthetic. My approach when I used to do these would be to find that area of skin, and you can helpfully see on this manikin there's already a hole where some medical students have been using it before. And what you do is using a very small needle, put it just slightly under the skin, inject a small bit of local anaesthetic, and this is often where you'll hear someone saying sharp scratch, because it just feels a bit like a bee sting, and that's the sensation of the nerve fibres that are going to send it pain information towards the brain. That's the sensation of them going numb. You feel a bit of a burn as those nerve fibres start to go numb. So I did that with a small needle first to numb the top layer of skin. And then typically what we would do is then numb a slightly deeper area along the tract we're going to go along. So finding that area where we want to do our lumbar puncture, and then I tend to inject a local anaesthetic along that trajectory. Again, at this point, the patient may well be have some drapes on them. This area may be covered apart from this little rectangle. So once you've used the local anaesthetic, the skin should become nice and numb after about 2 minutes, although that time period can be variable in different people. And to be clear, what that does is it makes the top layer of skin numb, so you shouldn't feel the sharpness when the needle goes in. Now, a lumbar puncture needle is very, very similar to any old needle that you would use to take blood. It's essentially a hollow needle that allows fluid to come out of it. It's just slightly longer. And in actual fact, it's also much narrower. It's much narrower, so it leaves a very, very small hole at the base of the spine. As a result, the fluid comes out quite slowly because it's that much narrower. And that's something that we're going to see shortly. So once I've done the local anaesthetic and I've checked that that area feels numb for the individual, it's about time for me to start the lumbar puncture. So it's one of these needles that, like I said before, is thin, but is rather long. We don't use the whole length of that needle, and we find out exactly where those bony landmarks are, and then essentially identify the best angle to put it in. And this is done by the doctor or the specialist nurse undertaking the procedure, and they'll know exactly what angle to put the needle in. And essentially it just goes in to the space like that, and then they'll withdraw what's called an introducer and pop this on. This is called a manometer, and this allows us to measure the pressure of the fluid in the spinal system. So this is very similar to an old school thermometer. And essentially, I'm not sure if you can see it on the camera, but you can see the fluid ascending up here. And this, like I said before, will allow us to tell the pressure. And it will give us a reading. This has reached about 20 to 21 centimeters of water, which is a very normal reading. And then the next step will be to actually start collecting the samples. So my assistant here will position a tube underneath just here, and then I'm going to try and collect that fluid from there. Okay, perfect. And typically what they'll do is collect about 20 drops in each bottle. Okay, so that's the first one done. So we get the next one ready. And take the one away, we can now collect it. You see, unlike a blood test where the blood comes out very quickly, this comes out rather slowly. It's because there's a low pressure in the spinal system, but also because we're using a very narrow needle. And we'll typically collect about 3 different bottles. Okay. Once that's done, the manometer can come off, the introducer goes back in, and then the needle comes back out. Okay, so very quickly, just pulled straight out, and the doctor then will push on this area of skin. In total, a lumbar puncture is going to take you about 20, 25 minutes. Inevitably, the appointment times tend to be about an hour, because by the time you've arrived, the doctor or nurse has done all of their checks to make sure it's safe to proceed with a lumbar puncture. So that, again, that's checking any blood tests, checking any medications that you're on, checking any scans that have been done to make sure it's safe to proceed, getting you to sign a form, a consent form, so you're happy to have the procedure, getting you in the right position, anaesthetic, lumbar puncture. And then usually we ask people to lie down for at least 10 minutes afterwards, sometimes longer. That adds up to about an hour or so. But actually, during the lumbar puncture itself, 2 to 5 minutes, really, really quick. It can be variable. Sometimes the doctor or nurse may not be able to get it in the right position the first time. Sometimes they may have to readjust and try a different level, either above or below. Very occasionally, it's really difficult to get the lumbar puncture from this one particular angle. And actually, a helpful way of doing it can be actually to sit someone up. And that's then very much like someone having an epidural. For instance, someone having childbirth and having a pain-giving epidural are often done sitting up, because it's much easier to feel the landmarks and to get the needle in the right place. But typically we prefer it to be on the left-hand side, because then you get that pressure measurement. All in all, a lumbar puncture takes about 30 minutes to 60 minutes.
Things to think about before lumbar puncture. It's an important test that helps support or rule out MS and other conditions. Results can be normal, even in people with MS, but the test is still useful. Risks are low, infection is extremely rare, and bleeding risk is checked beforehand. The most common side effect is a temporary low-pressure headache. Headache is usually worse standing and better lying flat. Staying well hydrated and having a caffeinated drinks afterwards may help. The procedure is quick, but the full appointment takes around an hour.